Now, across the globe, countries whose healthcare systems are buckling under the coronavirus pandemic are turning to Cuba for help. Since the start of the crisis, Cuba has sent more than 1,200 doctors and nurses to the front lines in 22 countries. Most have arrived into vulnerable African and Caribbean allies of Cuba, including Venezuela, Jamaica and Nicaragua, but also richer nations, including Italy and China. South Africa is the latest country to receive Cuba's help. These pictures were sent from an Airbus in Pretoria on Sunday. The Cuban doctors are being welcomed by the government and members of the Cuban community. Around 200 medical staff are helping South Africa's health system there. And for decades, in fact, Cuba has sent its doctors abroad, winning friends in remote countries, but also filling a desperate need. State media tells us more than 400,000 healthcare workers have been sent abroad since 1963, often seen as icons of Cuba's socialist solidarity. While some are sent on humanitarian grounds, many are paying for their service. The Economist says medical exports make up 46% of the island's export earnings. To put that into context for you, Cuba earned £6.3 billion, dollars even, for medical services in 2018. That's twice as much as it earned on tourism. While it is a major source of income, it offers an even bigger prize, diplomatic prestige. We found these pictures from Italy last month. Take a look. Doctors and nurses receiving a hero's welcome as they arrived in Lombardy. The pictures were posted by a pro-Cuban revolution group in Italy. Italy was the first developed European nation to accept Cuba's help during this pandemic. While many hail them heroes, critics believe Cuba's real interests are economic and diplomatic. The US is a staunch critic. In a statement to the Washington Post, the US State Department said the following: Cuba's deployment of medical missions overseas, while cloaked in altruism, is actually a scheme to generate income that exploits Cuban medical workers. They went on to say Cuba's medical missions program is not inherently humanitarian. The regime earns income by retaining up to 90% of the doctors' salaries. Well, the Wall Street Journal has harsher words. Back in 2015, it called Cuba's international doctor diplomacy its slave trade. Havana, as you might expect, denies all the allegations. Well, this is interesting. The Washington Post reports that some of Washington's Latin American allies who sent Cuban doctors back because of changes in leadership now urgently need their help to fight COVID-19. Let's get more context on all of that. Will Grant is our Central America correspondent. He joins me from his home here in the UK. Will, good to see you. Talking us through all of this, it's really hard to get past the fact that, these are key workers doing essential job-saving lives, and yet the politics around this is really casting a shadow on it, isn't it?
Yeah, I mean, this has always been controversial since its inception in a way, and it's always been a key part of the Cuban Revolution, the idea of sending brigades of doctors around the world to support like-minded nations, and not necessarily to support nations that just need the help and have turned to Cuba for that. They were there after the Haiti earthquake. They were there in the Ebola crisis in West Africa, and so on and so forth. If you go to that quote that you said from the State Department and calling it not inherently altruistic, I think that really gets to the crux of it. Does one believe that it is inherently altruistic, as as Havana claims, and as many of the doctors who go on these brigades say, or does one agree with Washington and Miami and the detractors of it and say, no, this is about funds coming into the Cuban government?
OK, Will, stay with us, because we're going to turn away from medical diplomacy and focus on whether Cuba is equipped to handle the coronavirus outbreak on the island itself. Cuba is somewhat a medical powerhouse. It boasts the world's highest ratio of doctors to population. Pro-Venezuelan media suggests Cuba has as many as 100,000 doctors, or 9 physicians for every 1,000 citizens. Its free healthcare system is considered a pillar of the revolution's success. Reuters described it as renowned for its focus on prevention, community-oriented primary healthcare and preparedness to fight epidemics. Cuba was quick to take action with the pandemic. Officials banned tourist arrivals, isolated at-risk groups and shut schools early. when the country still only had around 21 confirmed cases. But other factors make Cuba vulnerable. The country has the oldest population in the Americas. More than 20% are over the age of 60, and the pandemic is putting Cuba's fragile economy under even more strain. Well, The Economist reports containment measures are hurting food supplies, and many supermarket shelves are empty. These pictures give you a better sense of what life is like in the capital. The pictures on the left were taken in Havana last year, a bustling, vibrant city. The footage, though, on the right was captured a week ago. Havana now resembling a ghost town. Well, back to Will for more on this, talking about how they are exporting their specialism and expertise around the world. But, on home turf, how are they faring?
Well, normally, as you know, I would be speaking to you from Havana, but I happen to be back in the UK just for a short visit. And then Havana pulled up the drawbridge, part of those measures that you were saying that were taken very early, that were taken to make sure that the virus didn't spread as quickly as it was in other parts of the region. And they're doing pretty well in that regard. What do I mean by that? Well, they have only reported 48 fresh cases today. They have in total only had just under 60 deaths altogether since this whole COVID-19 situation began to unfold. So they are cautiously optimistic that they're beginning to see the top of the curve. They're beginning to flatten the curve on the island. That said, they're going to keep these measures in place. People have to wear face masks. There are cases being brought against people who break that. Obviously, it is a very centralized, controlling government. So people will be arrested if they break the law in many areas, which is, obviously a big question on the human rights situation on the island. But when it comes to these situations, Cuba's centralized system means that the Cuban government, the Communist Party, just makes a decision and it does get executed throughout the island. So, in a sense, that is working in their advantage. It is a mixed picture. There is still a lot of problems with social distancing in queues to find food. But by and large, they still haven't yet hit 60 deaths on the island. And I think they're cautiously optimistic about what that means.
Well, thank you very much for that, Will Grant there.